morning, everyone. Welcome to our Network Commons. We will begin in just a few minutes. Just want to give people a second or two to join us. And to my lovely partner in this project, Alexis, I believe we're still able to see your image on the screen. I wonder if we're able to bring that down before we officially start the webinar. And just to confirm with the chat, it sounds like folks can only see my image. Can a few folks in the chat let me know if that's correct? Perfect. Okay, great. Wonderful. Looks a little bit different on my end, but as long as you all can see me, that's great. And I'm going to give folks just one more minute and then we'll go ahead and kick off the webinar. Good question. I do have a question in the chat that says, is the AI note taker an official thing or just a participants? I'm actually not sure. We do record this on Otter just for our own note-taking purposes, as we will release a two-pager after this webinar that will include some of the resources that we discuss during today's session. Um, but perhaps some of my tech crew could look into that and let you know if it's a official thing or if it's just tied to a participant. And with that, let's go ahead and start today's webinar. Welcome, everyone. We're glad that you all could join us today for the next Network Commons in our series, From the Ground Up, How Communities Are Reclaiming Data for Change. My name is Ashley Hernandez, and I'm the Research and Product Manager at Build Healthy Places Network. And before we dive into the webinar, I want to acknowledge that I am speaking to you from San Francisco, the unceded territory of the Ramaytush Ohlone people, the original people of the San Francisco Peninsula who have been custodians of this land for generations. So as I continue on with the introduction to our work, please feel free to type in your name, your location, and your institutional affiliation in the chat. Some of you have already begun doing that. That's great. And some quick housekeeping items. So most of you are probably very familiar with Zoom by now, but just a quick reminder, use the Q&A function to suggest questions for our speakers and our panelists, which we will get to those questions at the end of the webinar. And then you can use the chat function for any technical difficulties that we need to troubleshoot, or if you have resources that you would like to share with the group during the presentation, or just general chatter, put that in the chat function. So Q&A for questions for our speakers, and then the chat box for technical issues to share resources, or just to share your point of view. So, we are excited to welcome you back to our Network Commons series. And for those of you who are joining us for the first time, welcome to this space where we explore topics relevant to multi-sector approaches to improve health equity through facilitated conversations from experts, practitioners, and advocates from across the country. So just a quick reminder, Build Healthy Places Network is part of the Public Health Institute, And we are a national center with a mission to foster multi-sector collaboration across healthcare, public health, and community development to really help accelerate community-centered investments in health and racial equity. And I also want to acknowledge all my incredible colleagues at Build Healthy Places Network who are really doing a lot of support work behind the scenes. In particular, shout out to Kevin Leacock, who participated in many brainstorming sessions with myself, as well as our co-executive director, Ruth Thomas Squans, and the incredible Alexis Sims, who is managing all the logistics for today's session, making my job so much easier. And with that, I will go ahead and turn it over to our co-executive director, Ruth Thomas Squants.
Thanks so much, Ashley. Hi, everybody. Thanks for joining us. It's a pleasure to welcome you into this space for shared learning and exchange. And I get the privilege to tee up what is going to be a great conversation today and take a few minutes to really set this in the context of BHPN's work. So, as Ashley mentioned, our focus is on multi-sector collaborations that address health equity through community-centered approaches. And one interest that we have been developing is how data serves multi-sector approaches and where we can go beyond community engagement to goals that center community control, ownership, and essentially the benefits of the data that communities are sharing with organizations and institutions all the time. So we believe that a robust multi-sector partnership needs to center community voices and lived experiences really to successfully advance health equity and opportunities for all. So we know data has power. How we collect it, frame it, and use data determines the decisions made by funders, made by policymakers, by anchor institutions, and ultimately is going to shape the future of our communities and their ability to achieve health equity and justice. So we want to ensure that communities have the power to shape their own futures through place-based planning, investment, and development. And that incorporates those vital conditions for health and well-being and supports health equity initiatives. So in a broader context, we also know that in the past year, there's been much turbulence at the federal level, impacting lots of data sets, causing disruptions, delays, uncertainties. And yet, really, at the same time, we know for many practitioners, even before all of this, there were frustrations with the traditional data sets. Too often, their whole execution excluded many of the voices of those that were most impacted. How well were they capturing lived experience? Were they asset focused or disease focused? And what story were those data sets telling? Because we know there is power in those stories. It dictates what and who is believed, and it directs what actions are taken to shape decisions and results. And what's more, for many communities, they weren't even included in those traditional data sets for if their population was too small, for example. So as we will hear later today, they had to innovate to better able to serve their communities meaningfully. So by moving beyond traditional data, these groups are building equity in their processes, they're building foundations of trustworthiness, and really stirring up good systems change. So join us as we explore how these organizations across community development, across health and philanthropy, begin or even deepen their community-driven approaches during these uncertain times. Thanks, Ashley. I'll let you take it from here, and I can't wait to hear from our panelists.
Thank you, Ruth. And before we get to our panelists, we want to do something a little bit fun. And so, what we would like to do is hear from you all in our audience and learn about your experience with data. So, my colleague Alexis is going to put up a QR code on the screen. And this is our first time trying this out, so be patient with us. Great. So I see the QR code. If folks don't see the QR code, just let me know. But what we would like y'all to do is just scan that code and you'll see a question. And the question is, what decisions are you making today with data that may not fully reflect your community's reality? And so let's give everyone about a minute to answer this question, and then we'll see the results of everyone's answers. Hmm.
I'm loving these words, Ashley. So many good.
Yeah, they're great. It's interesting because I think there's going to be a lot of overlap with what we hear from the panelists.
Interesting, isn't it? Yeah.
Yeah, I think, Alexis, we're probably at a good place where we can see the word cloud. So Alexis is going to put a word cloud up on the screen so we can all see everyone's answers and see if there were any answers that resonated with more people in the group. Great. So this is the final word cloud. It's interesting. We have a lot around funding and infrastructure, program development, um, one about values, equity, funding access, understanding impact, language access, engagement, residents, sense making. What's great to see on the screen is I think a lot of these topics are really going to overlap with some of the conversations that we're going to have with the panelists today. So it will be interesting to see what our panelists have to say on the different topic areas listed on this cloud. So thank you so much, everyone, for participating in that process. It was very interesting, at least on my end. And with that, let's go ahead and move to the speakers. And I'll have all the speakers turn on their camera and get on screen. And we're just waiting. Perfect. We have all the speakers now. So what we'll go ahead and do is just quickly introduce everybody. And so I'm going to start with Lakota Vogel of Four Bands Community Fund. And Lakota, could you tell us your title, your role, the work of your organization, and the communities you serve?
Yes, thank you, Ashley. I'm the executive director of Four Bands Community Fund, which is a native CDFI, community development financial institution, serving the Cheyenne River Sioux Reservation in north central South Dakota. And we also serve native entrepreneurs throughout the state of South Dakota.
Great. Thank you, Lakota. And next, let's go to Dr. Rashawn Gilmore. Rashawn, could you also tell us your title, your role, the work of your organization, and the communities you serve?
Sure. Thank you, Ashley. I'm delighted to be here. I'm D. Rashawn Gilmore, and I have the privilege and pleasure of serving as the founder, president, and CEO of Blackout here in Kansas City, Missouri. We are a 501c3 organization that's really focused on improving not only healthcare delivery, but healthcare outcomes for the Black LGBT community and all of our allies. And so we focus primarily on areas of sexual health and wellness, but our work, driven by the needs of community, has expanded into full primary care. We also prioritize community-based participatory action research as well as housing and a new focus area for us in advocacy, including using art as advocacy.
Oh, thank you, Rashawn. And now let's go to Catherine or Kathy Petit. And could you tell us your title, your role, the work of your organization, and the communities that you work with?
Sure. Hello, I'm a senior fellow at the Urban Institute, which is a nonpartisan policy organization in DC. We provide research and technical assistance for change makers across a wide range of issue areas. And from Urban, we coordinate the National Neighborhood Indicators Partnership, or NNIP. And that's a 30-year-old network that's composed of local organizations in more than 30 places. And each partner provides data and help to use data to shape strategies and investments to benefit neighborhoods and people who live there. I also co-direct the Robert Wood Johnson Foundation's Local Data for Equitable Communities grant program, and that supports 30 nonprofits annually to use data to improve community conditions connected to health.
Thank you, Kathy. Well, I'm super excited about this panel, and I'm going to go ahead and start with you, Lakota. So if we could just have Lakota and I on screen. Um, and thank you again, Lakota, for joining us. And for the first question, I would like Alexis to share a photo with us that Lakota provided before the webinar. Great. So, what about this picture, Lakota, highlights the values and your community holds and why? And what does it capture that numbers alone never could?
Yeah, thank you. So what Native CDFIs do is we ensure access to capital for our communities. And what this picture represents to me is a rural environment where we think about job creation oftentimes in America, and it's the large number of jobs, the large entrepreneurs that you hear about in the news. But we have young entrepreneurs like the individual closest to the screen who wanted to start a lawn mowing business, which was needed in the town of 5,000 people. And he did that to support himself through school and to go on into college. And we supported him with buying some of the equipment. And he actually hired, as you can tell, created some jobs. And it's an intergenerational opportunity as well. He often hired people older than himself, which was exciting. And you see that often in rural communities. And then just the building structure itself. Oftentimes, when you're in a rural community, you don't get the big shiny new offices. You have to operate out of a mobile home campus sometimes, as you're waiting to raise funds to build new buildings, or not at all, but this sort of represents rural community at its finest, with young entrepreneurs seeing a need and solving that need with starting small businesses and then even creating jobs for others.
Wow. Thank you so much for both sharing that image and using it as a way to really illustrate the assets and inspiration in the community you serve. And we can go ahead and move on to the next question. And Alexis, we won't need the photo for the next one. So, Lakota, as a Native Community Development Finance Institution, CDFI, when it comes to lending and measuring impact, why didn't traditional data or traditional definitions of risk work for your community?
Yeah. So, as I've mentioned before, we are working in the lending space. There's a movement out there called, native data sovereignty, and it's been going on for quite some time. So, in that data sovereignty space, there's a pervasive need that shows up in the data to categorize Native communities with the 5 Ds of data. This term was coined by Maggie Walter, who's one of the leading researchers. And so those Ds you might all be familiar with, but they're difference, disparity, disadvantage, dysfunction, and deprivation. So if you do a Google search right now about Native peoples, no matter the people's named, if they're in America or in another country, the response is the same: poor health, low educational outcomes, high suicide rates, high incarceration, et cetera. But for us, this data story had created a raced reality for us, and the traditional definitions of risk that the financial industry has put out there have enumerated and put value to these realities. And so for us, that wasn't good enough. I live and work and am from this community, and it felt interesting to know that these are the 5 Ds that describe us in the data, but it's not my lived reality. It's not how I show up to work, and it's not what I experience. It's not what my customers are walking in the door with. And so we really felt the need to redefine risk for our community and define the work that we're doing.
Yeah. And how did you start approaching data differently? And this really is more of a process question.
Mhm.
And how did that end up changing the way that you structured your financial products and services, or even the way that you make decisions as a CDFI?
Yeah, I think it started with just kind of the cultures of the organization, first of all, of just maintaining a value of curiosity. And knowing the framework that we're all operating in was built around us and not for us. And so just as a leader, always leading with encouraging my team to ask why, right? So the numbers and the statistics detailing why natives don't have access to capital, it's not disputed. The numbers exist. They're in all the research, but we know that reality all too well as community members, and it surrounds us. But accepting that numerical reality is not the same as accepting the validity of the financial processes that have been set up to put capital access into our communities. So we started looking at our own data. Every day customers walk in the door and we start talking to them about their credit score or wealth. And we actually have them fill out like personal financial statements. So we're getting a budget from every Native American community member that's walking in the door. And so we looked at our own data and our team said and continues to say, what are ways we could create our own narrative about our lived realities? So we reached out to some of our resources, like college institutions, and did some research. And then we also reached out to the Federal Reserve Bank of Minneapolis. They have the Center for Indian Country Development. We hired different data firms to analyze our data. And the important part is that we chose the variables. So it was very important for us to be involved in the development of the methodology, the collection, and the analysis, and then the share back to the community. And so in every one of those examples, we made sure that the four bands team in our insight was involved in every one of those examples. One of the biggest ones we did was we did a regression analysis with the support of a statistic group, and looked at what really was defining risk, right? And so in traditional frameworks of finance, there are risk categories that we think we know, and we felt those just qualitatively to not be true. And we said, why don't we just look at it ourselves? And we did a regression analysis of what is mitigating risk in our small business loan portfolio. And we came up with a whole different set of categories that either validated the way we were doing our work and assessing risk within our community and the way we were putting capital into the hands of community members.
Yeah, and do you have any examples of the way that you reframed risk?
Yeah, we removed the importance of equity and collateral, and everybody can gasp. If you've ever gotten money from anywhere, it always seems to be the one thing that financial institutions ask for is equity and collateral. So how much collateral do you have to support that? And those, no matter how much a borrower brought to the table, if you brought the most collateral possible, it did not have an impact on whether you paid back your loan or not, actually.
Mm,
So that was really eye-opening. I mean, we sensed that to be true. We had developed different ways of looking at collateral so that we could be creative with that risk rating, and actually knowing it had no effect on repayment ability was really interesting. And so we've been sharing this story a lot with being published in different financial institution, publications and working with the Federal Reserve on it. But it's a really hard thing to get the rest of America to change the framework of how they identify risk. Mm.
absolutely. And I do want to ask one question from the audience member, which is, could you share the 5 Ds of data again?
Yes, I can. So it's difference, disparity, disadvantage, dysfunction, and deprivation.
Great, perfect. And I do have one final question, which is, how did this new approach foster trust and financial inclusion and support for data sovereignty?
Yeah, I appreciate the question, Ashley. And I think to me it really was, and the way we work at our institution is it's about transparency and first and foremost, transparency and accountability to our community and to ourselves. And so to us, it's having the right data and democratizing it and showing it to our community and always describing it and what its implications can be. It's an ever-evolving conversation, but we can't hoard that information close to us. We have to share it back to the community so we can hear how they're interpreting it in their daily lives. And so that's the most important for us to, foster trust and financial inclusion for this within community. I think it uplifts the value of integrity at our organization. It's a really important value that we have at Four Bands Community Fund. Our entire team is involved, and we're always analyzing the intervention, if you will, that we're applying to our community. Maybe we're doing financial coaching, and we want to make sure that that's actually having an impact on the lives of the participants in the room. And so analyzing that every moment we get, but us being in control of it and just continuously asking the questions is really important. And it's how you perceive is how you proceed, right? So if my team is perceiving opportunity and not perceiving risk, we're going to proceed with opportunity. And so I think always maintaining your team's perception of the community and what the work that you're doing can only be done with the right data sets and constantly analyzing that work.
Yeah, I love that idea of building a culture that perceives opportunity. That's definitely a reframing. And I will say, my colleagues can probably drop this in the chat. We did feature four bands in one of our crosswalk articles on community-driven data. So check that out. It will be in the chat. And thank you so much, Lakota, for telling us about your work for this portion of the webinar. And we will, of course, chat again during the Q&A portion. And with that, I'm going to ask Rashawn to join me. Hi,
There we
Rashawn.
go. Hey, Ashley. So happy to be here today.
Yes, thank you for joining us. And so we also have a photo that Rashawn shared with us, if we could get that up on the screen. It's a beautiful photo. And Rashawn, how does this photo reflect your community's lived experience and represent what belonging looks like for the LGBTQ plus communities in Kansas City?
I appreciate the question, Ashley, and thank you for being here, and to all of our guests for tuning in today. We're all so busy, and folks made time. I really appreciate that. This particular image is reflective of a lot of things that might, at first glance go unnoticed. If you look at it, it seems a little bit monochromatic, and it is in a certain sense. But as I look at it, I see so much diversity here. Diversity in terms of age. There's diversity in terms of people's lived experiences. We have some of our trans members who are in this image. We have some of our folks who are bi. You wouldn't necessarily know that to look at the image. You just see a group of Black folk. But the biggest thing that this picture represents for me is Black queer joy. And in a time when our very histories, and if some have their way, lives are being extinguished and made invisible, this image is a bulwark in many ways against that narrative and that effort.
Yeah, that's beautiful. Thank you, Rashawn. And for the next question, well, you know what? We can keep this image on the screen
Okay.
if y'all. This is
Yeah,
a beautiful
I
image.
prefer that.
Okay, let's do it. But for the next question, why didn't traditional data collection or reporting methods reflect what your community was actually experiencing on the ground?
That's a really vital question because the data that was available, number one, was not disaggregated. And Blackout's experience with data, and I just have to be very clear, in April, we will hit our 9-year anniversary. And to think back on where we started. When we started Blackout, it was really in response to community need, but also because resources were drying up. I had been asked to take on a large multi-year CDC grant, and it was expiring. We rescued that grant. We turned things around. We're involving community. And finally, for the first time, the Black queer community in Kansas City is beginning to see a pathway for change for itself. And then the money runs out, as is too often, unfortunately, the case. But rather than just jump into starting a new organization, we knew that there needed to be some sort of successor initiative. I have to give credit to Dr. Jeanette Berkeley Patton at the University of Missouri, Kansas City School of Medicine. Dr. Berkeley Patton leads their community health research group and the Health Equity Institute at the university. But she approached me and she said, Rashawn, I know you all are getting ready to start this new organization. Can I encourage you to do something? And it was this thing that I'm about to tell you that really changed everything for Blackout and for our community. What Dr. Berkeley Patton suggested was that we do what had never been done before, which was a comprehensive health needs assessment. And prior efforts really prioritized the mainstream LGBT community. And I'm not going to tell you that everybody was excited about it. Some people felt quite threatened by it. There were others who, if they weren't threatened by it, and I mean institutions, organizations, aid service organizations, FQHCs, if they weren't threatened by it, then they were quite concerned that they were in partnership with us so that they can get access to the data. But we did things very, very, very differently. So we did do that comprehensive health needs assessment. We did not publish our data, which I know is anathema. So there's probably some academics and researchers here who are clutching their pearls right now. But the purpose for us was not, although it is a very good thing, to contribute to the larger body of scientific knowledge per se. Our goal was to utilize community-based participatory action research in the entirely new and proprietary frameworks and processes that we developed for that to create a pathway for our actual community advisory board. In the first meeting, they changed their name to Community Action Board. They were like, if we're giving up our Saturdays, we ain't going to be talking about advising nothing. We're going to be an action board. And too often research has them come in, get some information. They don't know what happens to it. They don't know where it gets published or if anything changes in their lives. They don't see it. And so we wanted to make sure we didn't do that. So what we did was we took these 21 members from our CAB, our Community Action Board, 18 to 34-year-old Black same gender loving men, some living with HIV, some not, some folk were actually trans, and we sent them through the same training that university folks go through. And so they became a part of the actual research team. They went through the CITI training, they went through the certification training, and our CAB members not only helped develop the survey assessment tool, but they were part of the IIB application, they were part of data collection, data analysis, and data reporting. Now, that being said, and I'm going to interrupt myself to apologize for this very long-winded answer, but I needed to give all this context and backdrop, so I apologize, Ashley. But what happened was we understood that if we published our data, what would happen is the same legacy organizations who always get the funding would take our data that we worked on as a community about us and our lives. They would take that data, they'd write a $5 million grant to the CDC or NIH or HRSA, SAMHSA, somebody. They would get that $5 million grant to do good work on behalf of Black gay people. And then we get like $5 or $10 to come take an HIV test. That is not what we wanted to do. Blackout being in existence is a direct result of how we approached our founding, which was in research and using that research to drive all of our decision making.
Yeah, and I think Rashawn, you've answered part of this next question, but if you'd
I
like to
tend to
add
do that,
any
Ashley.
more,
I'm sorry.
it's great. No, it's great because perhaps you can even add a little bit more detail, which
Sure.
is how did you begin gathering neighborhood level insights differently, and what did those insights unlock in terms of health and wellness support?
So happy to answer that. And I'm going to make a request, if I may, sort of directing live here. Alexis, would you mind taking this image down and just showing me, because I want folks to see the background in the space I was sharing with the other panelists and our hosts in the virtual green room, that this is not just a background that I picked off some Rob Report or some pretty magazine. This is Blackouts. We call it the Black Box, BLAQBOX. The Black Box is the first and only permanent safe space for the Black LGBT community and our allies in the state of Missouri. And I think it's important that I highlight that because, again, if you ask me how we got started and the specific question around sort of beginning to gather these neighborhood insights, it started with us understanding that we knew that the community had this particular need. I'll move my big old head out the way so y'all can see the space a little bit more there. And then on the lower level, we are building out this year our clinical space. So Blackout is doing direct primary care. So whether or not you have insurance, we're going to see you and take care of you. But that being said, we started, Ashley, by going to the community. The community are the experts. And I know a lot of people say that, but they don't really mean it. And I want to give a caution to folks who utilize data that if you don't truly understand that data, you shouldn't be reporting out on it.
Mm.
Full stop. I also believe that data that is shared without proper narrative, proper context, is violence because it misrepresents the communities that it's intended to serve. And so we have a duty and an obligation. I'm not an academically trained researcher. I consider myself a community researcher. And we just had this fundamental belief that if we trained community, if we put them in the driver's seat, they would tell us where we need to go. And we just simply asked the questions, Ashley. We didn't bring them in and say, okay, tell us if you like this stock photo image that we're going to use for the flyer. Oh, do you like this color? No, they had ownership. And that's also why at Blackout, we never have had, and as long as I am CEO, we'll never have clients or patients. At Blackout, they are members. They have ownership in the vision. They have ownership in the work, and everything that we do is for and because of them. They need to feel like that, starting with the research. So how do we begin to collect these neighborhood insights and do it differently? We created an events-based platform that really drew people to us. I often tell folks, if you had hopped in your car maybe prior to September 22nd, 2022, when we closed on this space, if you had gotten in your car, come to Kansas City and gotten my car and I'm picking you up and you said, okay, Rashawn, I'm ready to hit the ground running. Take me to where the Black queers hang out. Well, honey, the car's not leaving the airport. There would be no place to go. We might as well just party right here in the car until they come tow us away. But we also understood that if we appealed to community in a way that drew them to us, and then begin to engage with them. So let me take you on a little bit of a journey here. People often talk about, and I've been doing this for years since I got into this field, which I was not in prior to this. I was a happy serial entrepreneur making a few dollars, and now I'm a glorified volunteer that makes love offerings, it feels like. That's another story for another day. I used to always talk about moving from being transactional to relational, but that is not enough. We have to go from being transactional to relational to transformational. And if our work is not intended and designed to do that, if we're not letting data lead us in that way, if we're not engaging community in that way, I am telling you, we are failing ourselves, we are failing our missions, we are failing our constituents, and ultimately, we are failing to deliver on the promise of all these things that our great missions and our great organizations are set up to do. And I'm going to stop talking now.
No, that is great, Rashawn. And actually, because you answered my last question, I'm going to give you an audience question.
Okay.
And it's, can you give advice on how this can be done for city level quasi-government public health authorities? And before I do that, I do want to shout out for the audience, the chandelier behind
Yes.
Rashawn's head. It's a beautiful touch to that event space.
Thank you. I keep teasing Ashley. I said, we're switching that out and I'm going to box it up and send it to her as a thank you for being so kind to me today. But I will just offer, as I see the timer up there, and thank you so much for that. I would just offer that, for example, the city of St. Louis has reached out to us about doing something similar there. And here in Kansas City, to the questioner, our own health department asked us for our data. And then we actually had somebody at an AIDS service organization who had come from pharma and tried to derail our study. He came to Kansas City after we had started having conversations with folk in town about doing the study, and we decided that we were going to continue with ours. He decided he did not want to partner with us, and in fact went to our funder. It was the same funder that he was approaching and said to them they should not fund our study, they should fund his, because it's going to be over the entire LGBT community and it's going to be in partnership with the health department. And so therefore it would have more weight, credibility, all these things. And our perspective on that was very different. We knew what would happen if we did not get disaggregated data. There'd be this 500-page report produced, and on page 495, before all the credits and bibliography and stuff roll in, there'd be two lines that say, "Oh, and the Black queers need some stuff too." And so, when you're in a government or quasi-governmental role, obviously you're thinking about, can we do all the things for all the people? Let me just say this: this methodology that we have developed around research can be applied anywhere. We have purposely fine-tuned it for that. It doesn't matter if it's a CBO or community-based organization partner. It doesn't matter if it's a healthcare provider or a governmental entity or what have you. But what you must have is an intentionality at the forefront that says, hey, we are doing this by community and for community, or for and by community. At Blackout, the fact that we did this the way that we did it and didn't even do it in the name of or with the intention of being innovative or trying something different. I just am not a researcher. I'm an entrepreneur with a creative mind. And at that time, undiagnosed ADHD. So I had no shortage of ideas about what we could do. And so we were just kind of like Silicon Valley, move fast and break things because we did not know. But it was in that not knowing that led to now we have 4 other cities that have approached us about this model. And so right now we've brought on Dr. Obi McNair, who is leading a national initiative for us where we are taking our same exact model of research and we are doing it in, because we said, oh, we'll show you. They were like, no, come do it. Atlanta, Los Angeles, uh, Seattle, and Washington, D.C. And so it could be applied in these other ways. It doesn't matter if it's quasi-governmental or not. Yeah, Sean, I can't leave Atlanta out. All my family live down there, mom, dad, all my siblings, grandmother. But I just want to say that if you are interested in learning about our model, I would be happy to connect anyone with Dr. McNair from our team. And we're actually redoing our same study in Kansas City. That was 2018, basically. A lot has changed since then, even though the data is by no means still. By the way, let me just say this one piece in my 1 minute and 45 seconds that I have left here. If you want to know the power of data to transform lives and to transform organizations and to transform communities, you need look no further than Blackout. In our study, I'll throw out a few numbers for you really quickly. In my other life, I'm a television show host on PBS, and I'm used to having somebody either in my ear or telling me how much time I have, and they got the timer up here, so I'm going to take advantage of everything I got. By the numbers, our CAB came up with 116 different strategies to remediate the 7 high priority areas that they came up with that they wanted the study to focus on. I'll tell you what those 7 areas are very quickly: violence and criminality, HIV and sexual health, mental health, substance use, social, we prefer to call them social influences of health. They shouldn't be determinative of anything. Fitness, diet, and nutrition, and I may have said healthcare access. Of those 116 strategies, everything that Blackout has done from the time that we launched this study until today has been the result of us operationalizing one single aspect, one of those 116 strategies or interventions from our CAB around PrEP access. And today, we are the state of Missouri's largest teleprep provider. And we're not only serving Black folk here in urban Kansas City, we're serving lots of undocumented folks from as far away as Colombia and South America and Venezuela, and all sorts of rural folk across the state of Missouri. And all of that, the space that we bought, permanent space that we bought because of this research.
Well, that is so powerful, Rashawn. Thank you so much. And you met the time. Bravo. That's great. Um, it's actually a great transition to think about like peer-to-peer support and learning from different parts of the country, and to now bring in Kathy with the Institute's National Neighborhood Indicators Partnership. Thank you so much, Kathy, for joining us this afternoon.
Hello.
Um,
These 2 speakers were so energizing. I'm ready to go.
yes, and you're going to be a great third energizing speaker. And we also have a photo for you, so hopefully Alexis can get that up. And as Alexis is working on that, the first question I have for you, Kathy, is from your work at the National Neighborhood Indicators Partnership and its grants programs. What does it look like for a community to reclaim their data?
I love this question, and this is what inspires me every day. So we have examples from hundreds of places, including small towns, rural areas, and cities. This photo is of Jamal Kennard and a neighbor from the Lakeview neighborhood in Charlotte doing a data walk in 2022 with our NNIP partner, UNC Charlotte Urban Institute. And UNC provided some of the traditional indicators you would expect from the census and local data. But on this walk, people added their own perspectives about the neighborhood needs and assets. So it's just a great reminder. And I encourage you, if you need a little inspirational shot in the arm, to check out their 2-minute YouTube video that they'll put in the chat and I'll send afterwards.
Great. And oh, go ahead, Kathy.
Oh, no, I was just, I was going to describe a little bit about what NNIP partners do, since the name doesn't tell it all. I think, for example, this UNC Charlotte example and our other partners, which you can take that photo down whenever you're ready, they support neighborhood associations and local groups with community-led data in a bunch of different ways. And I think you heard some of those ways in the stories ahead. They help to make connections between community groups and institutions with power. They offer training and coaching and technical assistance, and they convene to provide a space for peer learning and exchange. And this really fits into our vision broader than any one organization of community data capacity, which is where people can access and use data to inform efforts to understand and improve outcomes where they live, which we just heard 2 great stories about. This means that all residents, governments, nonprofits, hospitals, philanthropy, everybody on this call who serves the community should have what they need to use data effectively. And in short, everyone can be a data person drawing from their own perspective. And this includes, as Ruth mentioned, assessing when the national data can be used and when it's enough, and identifying data gaps. So we have a set of network goals to use data to improve equity, because not every person or community have had the same opportunities to build the skills to use data to advocate for what they need. So we really make sure that all people, but especially marginalized groups that have been denied access to data or harmed by data in the past, have the ability to use data for their own priorities. And this is all very high level and conceptual, especially compared to the first 2 stories, but I can give a couple of quick examples. Our partner in Hartford, the Connecticut Data Collaborative, run the Hartford Youth Data Fellowship that provides youth with the tools and experience they need to engage and analyze data about their communities. It's funded by a consortium of funders that have come together. It's a 5-month after-school program with workshops about data literacy, analysis, visualization, and the youth are co-researchers to share their data insights based on the quantitative data, but also on their experience growing up in Hartford. And then the program culminates in a data walk where the youth present and engage with community members and city leaders. And this program is fantastic, both because the community immediately benefits from their research and insights, really with improved quality of information, as Ruth mentioned, and the youth participating take the skills they've learned and the confidence to use the data forward in whatever they do. And then just a short second example, since I know there's a lot of healthcare organizations on the call, in a past grant program, Corewell Health South, which is a Southwest Michigan health system, collaborated with community members in Benton Harbor, Michigan, which is a majority Black community, on a project to address residents' distrust of healthcare providers and systems. So they co-designed a resident survey to collect perspectives on community trust, and the survey highlighted the need for improvement in a bunch of areas: safety and youth engagement, cleanliness, bringing the community together, and generating pride. And many projects would stop right there, but the community partners in this project with Corewell developed a mini grant initiative to provide $500 for about 10 programs, youth programs, community cleanups, all related to addressing issues identified in the survey. So this is really, I think that Lakota mentioned the importance of trust, and that's really was at the core of this work, but also moving to action and not just letting the data sort of sit on the shelf in an academic way.
Hmm. Yeah, and that does bring me to my second question, and it's really thinking about the role of funders, whether that's philanthropists or impact investment in funders like hospital systems, and how they can support community-led data without extracting or over standardizing it.
Funders are really essential partners in local data ecosystems. And a few years ago, we worked with an advisory group of local funders to develop a brief that I'll share that outlined three main roles that funders can play. One is something I think they're already comfortable with, which is promote the use of data by their own grantees. So this means both funding them and providing learning opportunities to establish sort of the structures and activities, like we heard in the first two stories, that both initiate and sustain the community-led data practices.
Right.
Funders have the ability to create a safe space and really build a positive culture for data and learning, but it means that they should not overburden or penalize organizations with detailed and onerous reporting requirements. Funding was the biggest word you saw in your word cloud. So we don't want data just to be, a requirement, but really be useful to the mission. They can also build it into the criteria. So in our local data for equitable communities grant program, one of the selection criteria is the quality of community involvement. So how well do they propose to integrate the people who are most affected by the issues throughout the project? And then during the grant implementation, our grantees can exchange ideas about what is working in this area and what doesn't. So that's the first, promote the use of data by grantees. But Foundation's checkbook is only one of their assets. They really bring thought leadership and convening power. They can be champions for community data capacity and community-led data initiatives. And they can also convince their peers to support this kind of work and expand the base for sustaining the initiative. One strategy and example is to convene across sectors, advocacy organizations, practitioners, government, to discuss what are the information gaps and data capacities needed to advance action on a specific issue, such as LGBTQ health or housing affordability, really those really sticky, hard questions. And then finally, funders can invest directly in building community-wide data capacity. So this is both funding resources and services that strengthen the whole community's ability to ensure data initiatives are community-led. So this is really, infrastructure for many organizations in a place to have principled data practices, whether through tools or support services or the peer learning spaces. And I don't know if they're on the call, but one great example is Greater Hartford Gives Foundation, which is a community foundation that explicitly has a strategy to support a strong data ecosystem in Connecticut. So they're one of the funders of the Youth Fellows program that I mentioned, but they also fund the Community Wellbeing Survey by our partner Data Haven and New Haven, which is also funded by some hospitals that are there. Another great example, I just talked to the director of a Spartanburg County Hospital, which is in South Carolina, and they're part of a funder consortium that funds the Strategic Spartanburg Community Indicators Project. And they talked about how they worked with the Strategic Spartanburg to really do a focus group to help youth interpret the data as as an adolescent health initiative. So not just the numbers again, but really the experiences that they provide. So support your grantees, champion local data capacity, and invest directly in the local data ecosystem. All can be roles that funders can play.
Fantastic. And after the webinar, we will send a lot of this information in a two-pager that will include all the different roles you just described, Kathy. And in addition to that, that gets to my last question, which these will also be included in that two-pager, is what resources are available from the National Neighborhood Indicators Partnership or elsewhere to support local organizations in building the capacity to collect, to interpret, and to use data rooted in community priorities.
Yeah, we love to share our ideas and lessons from NNIP's experience and to hear the great examples too. But some people can be intimidated by even getting started if they are not, if they haven't been in this space. And really, we have to retrain ourselves to think differently about how data is collected and interpreted and used. But one of NNIP's values is that collaboration speeds progress. So our experience shows community data capacity is much stronger when groups leverage each other's strengths. Community groups and the funders and institutions with power, nobody needs to do it alone. And I think I loved both Rashawn and Lakota gave good examples I'd like to call out of productive academic partnerships and their stories. The trust and partnerships need to be really thoughtfully developed over time. And as they mentioned, structured to keep community in the driver's seat. But you have in your area applied university centers, community data nonprofits, regional planning groups, others that can be great collaborators in support of the community-led efforts. Another just plug, I think, is to, as you mentioned, cultivate a community of practice in your area for peer-to-peer sharing. And this is one of the key elements we have of collective data capacity. And these can take a lot of forms. So several of our partners have data days for building community and celebrating using data. Data you can use in Milwaukee has data dives where people gather regularly to share data and solutions for health issues like violence prevention or youth mental health care. So I think so this is both the external partnerships, communities of practice and peer learning, but there's also a lot of more structured publications, tools, and guides to provide ideas, which we can give you afterwards. Data you can use, I just mentioned, has an amazing model called Data Chats, which really is structured for community conversations about data designed to draw out resident experiences. My colleagues at the Urban Institute Community Engagement Group have several toolkits, including establishing a community advisory board, but I'm going to share with them Rashawn's notice that it should be Community Action Advisory Board. And there's really exciting developments with community governance of data. I think this is a really important area. Both Lakota and Rashawn mentioned how important control of the data is. And there's a great actionable intelligence of social policy publication on participatory governance, as well as the one that you guys have published through Build Healthy Places on community-driven data and evaluation. So I think we're excited to see so much momentum. I love that so many people, we have almost 200 people today behind community-led data and many more groups like Four Bands and Blackout modeling how this works in different contexts. I'm thinking about the 200 places that people represent who are on the call. So I just speak and urge you to take inspiration from today. And I am confident you can find small ways to incorporate these ideas into the work you're already doing, or share great community-led practices that you are doing with other people in your community to sort of spread the love. And I hope you'll look for new opportunities to really expand community-led data. So I'd love to hear the group's questions and hear what other things we can help them with.
Yes, definitely. Thank you, Kathy. And I will let everyone know that we will be sharing all the resources that we've discussed today, as well as the recording after the webinar. So folks, make sure to sign up to our newsletter so that you get the email with a recording as well as some of those resources. With that, I would like to have all the panelists join me on screen. Thank you, everyone. And we will get to the audience's Q&A. Our panelists have another 20 minutes to stay with us if you are able to stay on. And if you're not able, one of my colleagues will drop a survey link in the chat. Please fill that out. It's really important for us to know what you enjoyed about the webinar, if there are other topic areas you would like us to touch on in future webinars, and if there's anything we can improve on. But with that, let's get to the questions. So I'm going to first start with a question. I believe this is going to be for Lakota. Can you share more about examples of putting capital into the hands of the community?
Yeah, sorry. So as a community development financial institution, it's just sort of what we do. And so what that means is we're an unregulated financial institution certified by Department of Treasury. So what I do is I spend most of my day fundraising and saying, please give us funds. And then I listen to the community need of what they need funds for, and we create loan products to lend to our community. So that looks like small business loans, mortgages, home renovations, home equity lines of credit. We do everything except basically vehicle loans. We could, but it's a fun job. You basically get to use money as a tool and mold it to the shape that fits your community.
Thank you. And this next question is for you, Rashawn. Um, and you mentioned you have refined your process and it could be reproduced anywhere. Where can we find that template? And does that template exist?
That's a great question, and it does exist, but it only exists internally at this point. We are in the process, actually, of developing tools not only for our new installment, if you will, of the study, but for the other four sites that I mentioned earlier. However, we are routinely receiving requests to either come and train or to share. And so Dr. McNair, our CAB, and our research advisory board. So we've got a bunch of research professionals from far and wide across the country who are contributing to that as well. And those materials will be available. I don't want to get fired by my employees, but I think that late August is what I'm being told right now. So I would really encourage you all, and it's not oh, go to our website and fill out the little form. If you fill out the contact form, that actually makes sure it gets to all the right people. If you email me, it goes into an abyss and never to be seen again. Sorry. But that framework we are refining, and we do have some training materials by way of video that I think will be available sooner rather than later, that at least give you a sort of a broader view of the major components of that. But we're happy to share. I don't believe in gatekeeping like that. If you're doing something that's making a difference, I want everybody to know how to do it.
Absolutely. And this next question I think is very interesting, and anyone's really welcome to answer it. And it's what insights or suggestions might you have to encourage funders to account for the time and resources it takes to engage in community-driven data gathering and analysis? So this individual said, for example, I experienced funders developing more awareness for the value of community-driven data. However, funding is not always offered to support community-based organizations and their staff to engage and train communities, provide incentives or compensation for community members themselves to actually develop community-driven outcomes.
I can take a stab to start with. I do think seeing examples like Rashawn's and Lakota's, that the outcomes and the end results that funders care about are more likely to happen if you engage communities. You're going to get to the right solutions. You're not going to, like Rashawn said, have some outsider come in and decide that some national model is right for you. So, and I will not be able to attribute this. I'll go find it. But I saw this great comment on a LinkedIn once that the idea that it takes extra time is actually like a false narrative, because not including communities and then doing it all in the corner and getting to the wrong or incomplete answers will actually, then you'll have to backtrack and figure things out afterwards. So it's about putting the time in up front. That is more traditional distanced research would put afterwards. That's there, and I think this compensation of funders, if you, all of our guidebooks recommend that too. So if you want to, having national folks like ours look across cities and say, this is the best practice, hopefully you can help point to that too.
I didn't really think I had anything to add because Kathy just said that so perfectly and well. And so I'm going to approach this from a slightly different perspective. Kathy rightly said that you think you're saving time by not doing all the front end work. Because again, it's that African proverb. I don't know if you've heard it before, folks. It basically says, if you want to go fast, go alone. But if you want to go far, go together. And so really set your objectives out, because when you're doing, community-based research and you think you can approach it the same way that you might do it on your own in your lab, or that's not it. And so in the same way that putting that work in up front will benefit you, the piece I want to say is on the back end, it empowers you in a way that you cannot imagine. We had IRB approved study. We had empirical data. Nobody was telling us this, that, or the other. And so even with funders, you're able to go to them and say, hey, our data shows us something else. Our data, which comes directly from community and their leadership, their involvement, them being centered, is telling us something else. That carries a great deal of weight. And just as Kathy said, you may not want to put the work in on the front end, but it's worth it to do that, because the implications for funding allocations, whether it's through foundations or through municipal or state, federal governments, whether that is in terms of public policy, whether that is in terms of best practices for other nonprofit organizations and healthcare groups. Like, there's so many things that can come from you having this data. And ultimately, it puts you in a position where folks are not as empowered as they might otherwise be to challenge the directions that you and community want to go.
Great. Yeah. And so many interesting questions. So I'm going to try to get to all of them. But what are some challenges you all see around engaging community and solutions, whether they're big or small, you implement to address community distrust, given the harm that many of these communities have experienced historically?
Kathy, did you want to go?
Well, I can certainly start in some of the practice that we have. One is to acknowledge the harm, and you might just need to take time to get through that. I think I heard from my partner in Pittsburgh with some work from the de Beaumont Foundation that when they tried to bring community members and government folks together to talk about ownership of public health data, that it just took longer than the government folks expected to really build that trust. And the reminder, really still harm is being done with data today. So this is not long distant past. So honoring the history of the place is really important. And then proving that you are trustworthy. I think Lakota talked about integrity, returning the data, listening, following through on your actions, shifting power to them. So that's what I've seen work in places around the country, and certainly demonstrated by these examples. But Rashawn and Lakota, you want to chime in?
Sure. Just real quickly, I think that, and what Kathy said is absolutely right. I think acknowledging past and present harms is an important part of this. And I would not assume that community members of any age, especially, don't know about these past harms and mistrust, because it came up over and over and over again. We're talking 18 to 34-year-olds, and they were on it. They were talking about Tuskegee. They were talking about Henrietta Lacks. They were talking about the origins of gynecology and obstetrics in this country, and the gross, awful experimentation and torture done on Black women and Black women's bodies. And so that's important. I want to give a resource that everybody should really look into if you're interested in trying to broach that. Then I'm going to give you my answer for that question. It's called the Repair Project. And the Repair Project, I think it was held, and there's two different ones, by the way, that I'm aware of. But one of them, the one that came out of, I believe, was UCSF, and then the University of Kansas, across the state line from me here in Kansas City, they have a branch of that with the African American Research Center there. My point being this: it talks about how to acknowledge those past harms and then move forward from there in terms of building your processes for engagement. My answer to the question directly, however, is again, it's about relationship and trust. If you think you're going to parachute in and just throw some cookies on the table and some cheese trays, and all of a sudden, community is just going to open up to you, and ooh, they're not going to do that. They need to know and be convinced of the genuineness of your care and of your commitment to protecting them, their data, and their communities. If you
Mm,
do not have that mix, you will not be successful, period.
excellent. And Lakota, I don't know if you want to add
Yeah, I
anything.
think the only thing that we've committed to doing is not adding to deficit framed indigenous data. So, and I think that's allowed us to frame it differently from community. There's always a way to frame it from an asset-based perspective. And I think our community is inundated with deficit framed data about themselves. And so what we've done is just our role in the world is to put out the positive. And there's always a way to frame it in that way if you perceive it correctly.
Uh, that's been very important to us at BHBN to really try to think about data and storytelling from a asset framing. Um, and we are sort of trained to think from a deficit mindset, right? So it's something that we constantly have to work on. By we, I speak for myself, but I do really
And
appreciate that.
funders, because funders are looking for like evidence of need. So we're,
Right.
that's the like pattern we get into of talking about all those bad outcomes that Lakota mentioned so that we can get the funding so we can do something about it. So it's a hard pattern to break.
Absolutely. And I do have another interesting question. Do you have any pointers for how to get buy-in from staff who are passionate about and used to spend their time on service provision and have developed an aversion to data activities, likely because of past data not having utility for their communities? And anyone can start on that one.
I'll just say, show them how it shows up.
Mhm.
I mean, for me, it's very easy because we're having meetings in this space, and so our community members know that from data, something has actually moved, something has actually happened, and it could be something good or it could be something bad. But people need to see the connection to it, see how it's applied, and for your staffs, I think that's important for them because they're otherwise like, what are we doing this for? I'm not a nerd. I don't want to just be sitting here looking at a bunch of zeros and ones or whatever people's perception of it is. I think they have to see it as you too are an expert in community because you're from community. And that way, I think it helps people, are an expert in research because you're from community. I think that helps.
Yeah, I was going to say, put those people in charge of it, actually.
Hmm.
Um, they'll do what's best and they'll learn the process and yeah, I would start putting them on the team.
Yeah.
And I think there's creative ways. We're about to publish a report on local data and arts and culture and integrating the two. So you don't have to just show the like boring line chart or something. Really think of creative ways for them to engage and understand because they probably have done several pointless,
Mhm.
long-standing data exercises that didn't result in any change. So they're coming from their own experience, right? So you need to give them something new.
I just wanted to quickly add one quick thing because of what Kathy just said. I think that you'll also find that the same approach works in community too. Lakota is right on the money. Put them in charge, put them up front, let them do it. I think the exact same thing is applicable there. It makes all the difference in terms of their own ownership.
Yeah, I'm gonna snap for that one. Um, another great question, y'all. Can the panelists speak to the use of leading indicators of community-led systems change? What are examples of some non-traditional metrics that can be recognized as meaningful leading indicators of incremental change?
I answer that question with a question, and that is, what do you trust? What do you trust? when you are making decisions, you can have, this is just our run of show for today. You could have all these notes or whatever, but in your gut, in your mind, what are the indicators that you are looking at, whether it's for something for in your professional role or in your personal life? What are the things that you trust? Because those same things often are true. Are we really hearing from people? Do I have the full story? Where else do I need to look? What question was not asked? What question was not fully answered? All of those kinds of things really do make the difference. And unfortunately, if there's a book out there about it, I have not seen it yet. It may exist, and I would love to read it. So if you want to point me to it, and I mean it sincerely, please do. But I think it's looking at the non-traditional indicators, in research that we use in our own lives. It's very much the same. There are no secrets. Let me just say, there are no secret processes. There are no magic wands, no magic spells. Am I right, Kathy Lakota? It's just bring your own humanness into this and how you approach your own decision making. I think that is the biggest part of this. And then listen to community. I believe it was Ella Baker, the great civil rights organizer, who said, people did not need to be led, they needed to be empowered to lead. And then they come up with all the right answers that we can then implement.
I do think this primary data collection, how people perceive things, is an early indicator before outcomes might change. So I think these are both good examples, and we're have a lot of that cropping up in our network, especially with all the government changes. But there's some creative things. I think one of Baltimore's vital signs indicators is community permits for like block parties to close off the street, like seeing more community participation. Those early signs of trust, like to Rashawn's point, are they showing up at the meetings? Do they come on Saturdays still? So I think there are creative ways, but again, they probably have an instinctual sense of like, if I see this, I know something is happening that's good, that will eventually move those big outcomes that we want.
And with that, I do have one last question. I don't think I've asked it yet. And this is for Kathy, but the other panelists can also respond. Can you expand a bit more on not burdening or penalizing community-based organizations slash grantees, especially for funding orgs wanting to invest, but needing to balance the need for data, for their reporting, and for building up local data capacity? How can we begin to have those conversations?
I'm not sure I understood the question. Could you get that back
Yeah.
to us one more
Is it
time?
from the funder's point of view or from the community organization's point of view? Can you tell who's asking?
So if the person is still here, please
Oh,
put in the
okay.
chat. I think this is from the funder's point of view,
Yep.
not wanting to penalize or burden
Yep.
grantees. Um, do you want me to repeat that question now that you know who I interpret as the audience member?
Oh,
Yeah, if you could, that would be great.
Okay, great. So can Kathy expand a bit more on not burdening or penalizing community-based organizations or grantees, especially for funding orgs wanting to invest, but
mhm.
needing to balance the need for data for their reporting and for building up local data capacity? How can we begin to have those conversations?
Yeah, I think some honest sit downs. Well, one, some self-reflection about what data do you actually use that you collect from the folks, and are they using that data? And is there data that you can collect that you both are using on both sides? And there are some really good examples of trying to align reporting requirements among local funders. Like if you have 4 local funders and you have to report 4 different measures of youth learning or whatever, then that's so much time wasted. And then people hate data pretty after they have to go through that. So I think both some hard self-reflection about what is used. For example, I receive philanthropic funding, and my national funders don't require narrative reports anymore at the end. Like we used to spend some time putting final reports together, and we're talking with them along the way. They know what we have been doing. So just like really weighing the, burden versus value, I think on both the funders and the grantees side. And I am really confident that some obvious improvements will come through.
Mm-hmm. We probably have time for one more response, Rashawn or Lakota, if you have anything else you want to say about that question.
Or as a grantee, how you feel.
Yes, or as a grantee, yeah.
Mm.
I found it good to what we did was we operationalized our mission statement early on. And so by doing that, we did what Kathy suggested of just telling the funder, this is the data that's useful to us and ensuring that it aligns. And then you do find the funders that align with your goals of collecting your own data and it aligning with their reporting format. There are a few things that are, extra that we do have to report on, but we always make sure that, like you said, Ashley, or I think Kathy, even just repeating it back to the funder and saying, are you using this data and how are you using it and asking those questions. But owning a process, being able to describe the process of how you thought about the data you're collecting seems to satisfy a lot of the funders if you've put in the work and the time to do that. It takes a little bit of time to make sure that your systems are set up so you are consistently collecting that data. But I would say it was worth it. It empowered us as a local nonprofit to be able to reclaim the space of saying, this is what's worth our administrative effort of collecting data, and this is what we'd like you to, measure us based off of. So
I think the data collection reflects a sense of trust too, and for the funders to really think about risk. So for our Robert Wood Johnson Foundation, we don't require a budget to be submitted. It's a $50,000 grant, so it's not huge. And we don't require financial reporting. Nonprofits spend 90% of their money on staff. So the sort of the ability, and different funders will be at different levels, but yeah, thinking about the same principle I think that Lakota said about collateral, like how much risk does this actually save you along the way.
I was going to refrain from commenting, but
Sorry, I
but
being too honest.
I feel compelled now, Kathy. Especially based off what you and Lakota shared, because I agree 100%. I'm going to give you two words, and they're going to be in the way of what some might consider nonprofit malpractice, maybe malfeasance. That is swipe left. And I think we've got to stop thinking that just because somebody's got a check for us, we need to go
Mm-hmm.
be in a relationship with them. If there's not alignment with funders, and I get it, everybody doesn't have that. And Blackout could probably be much larger than we are right now, but there are certainly times, just happened this past week, where we tell funders no, there's not alignment. We either feel like you don't understand us, you don't understand our community or our work, and even if you give us a check today, you're going to be a problem tomorrow.
Mm-hmm.
That's one. Or two, very often we find that it's funding in the way of just do it this way. And so when we started Blackout, there were three funders that we said we would not pursue or accept funding from. I won't name them; it's irrelevant. Two of them are government agencies, but the point was we wanted to make sure there was alignment. If you have that opportunity to do what Kathy described and to really engage, and Lakota said it too, engage with your funders, that's the best thing to make sure they get you and get your work. But I, as my granny used to say, and yesterday was her birthday, so I'll give her a shout out. All money ain't good money. And with that,
We'll definitely use that quote in our two-pager for the webinar, Rashawn.
But
It's an
maybe end
excellent
with something a
one.
little more uplifting. Yeah.
That's
And with
right.
the Black joy.
That's right. Well, thank you so much to the panelists, and thank you so much to the 93 attendees who stayed the whole time. We really appreciate that. And before you leave, there will be a link to our newsletter. Make sure to sign up for BHPN's newsletter because that's where we will send the recording. We will also send a two-pager that will be a companion piece to this webinar, as well as any additional information that we publish on this topic area of community-driven data. And finally, big plug, please fill out the survey. It will be so helpful. We like to do a few network commons a year, so we will definitely take your feedback to improve each session. So, with that, thank you, everyone. Thank you so much to our panelists. Thank you so much to the BHPN team. It was a wonderful conversation, and have a great afternoon.